At Providence Mission Hospital's emergency room in Orange County, California, the Omicron variant brought a record number of patients, putting a strain on hospital staff that have already taken a beating. Despite the onslaught, trauma nurse Amy Langdale says she still gets asked if COVID is real.
I don't think the public understands necessarily what we're still seeing and dealing with. And, we were heroes for a month. And we didn't like being heroes because we're not heroes, we're doing our job.
Orange County has one of the highest COVID-19 hospitalization rates in the state, where cases peaked about 2 weeks ago. Fewer intensive care beds are needed for this less deadly but highly contagious variant, but doctors say it is still inflicting major lung damage on the unvaccinated. Depleted by sickness and resignations, many staff members say they have caught COVID twice, have had little time to process hundreds of coronavirus deaths, and face tense moments with patients and families in a county known for its conservative bent, according to about a dozen doctors and nurses who spoke to Reuters.
The past 2 years has been the worst 2 years of a lot of our lives, and there's been a lot of laughter, but I think there's just an underlying kind of depression.
The flood of cases has left emergency room patients waiting on gurneys in hospital corridors. Around 80% of patients on ventilators in intensive care are unvaccinated, according to a critical care specialist at Providence Mission. As cases fall nationally, deaths, which lag behind, have been rising, averaging over 2,500 a day. ICU nurse Danielle Shaw says everyone is burnt out.
Some have even stepped away from hospital nursing, some have switched departments completely.
But with patients still suffering, she says they'll keep their heads down and just keep working.